Recording. Okay. All right. So this is case 7. The patient is 16 years old, has a incomplete spinal cord injury at T12 affecting her left side. I'll sit down just so I'm in the shot. The biggest things that affect her with this is she has a little bit of swelling in her lower left leg. It looks like she has maybe her hip flexors and hip adductors are slightly affected. Her knee flexor and hip extensor is a little bit weaker, fair plus, and then her quadriceps is fair plus, and then her ankle for her anterior tibialis and her gastrocs is pretty weak, but she wears an AFO on that side. So we're gonna go use that case. So the first thing we're gonna do is adjust these crutches for her. These are loft strand crutches. And then so I'll go ahead and take those from her. I'm going to put this one aside so we can adjust one at a time. And she's supervision with walking, so her standing is good. And so what you want to do is you're going to rest the patient's hand down at her side, and then you're going to adjust the handle so that it's level with their wrist. So this one is pretty close to that. So we could probably keep the length of the shaft good. And then so I'm going to have her put her hand in there. And then the problem now, probably I don't know if you can see it, but the cup is right against her elbow. So I'm going to need to adjust the cup down a little lower. You want probably at least a few finger widths in there to make it shorter. Alright. Okay. Go ahead and hold on there. That's just going to hold on here like that. And then this one, same thing. And it only just this particular pair of loft strand crutches I could get.
Supposed to.
That's fine. This particular pair of loft strand crutches that I got, this is the shortest that I could get because I borrowed them from work. So the cup doesn't quite adjust as low as I would want. I would normally adjust it a little bit lower as far as the forearm brace of part of the crutch. And so now she's going to hold on here. And so one of the cues I'll give her is to stand tall. I have to grab my gait belt, but I would normally be fairly close to the patient. Put the gait belt on her. Right. And so she walks with a 2-point gait pattern. I can adjust the camera a little lower so that you can see what that looks like. Alright, so the patient usually ambulates with supervision, but I'm going to stay close just in case since it is an altered gait pattern. So we're going to try to demonstrate 2-point gait, and so that means it's going to be, when she advances 1 foot, it'll be the opposite crutch. So go ahead and give it a try. There we go. There you go. Good. I think the only critique I would give her with that one is just making sure that when the crutch advances, it advances at the same space as the foot. The crutch was leading her a little bit, which would make her lean over a little. But this is the first time my mock patient has done it, so it was pretty good. Doing everything that I intend to as far as for the checkoff. So we're going to do, whenever I advance the left foot, the crutch moves at the same distance, about shoulder width apart. And same thing with the other foot. Every time, I usually try to explain it to my patients, every time the foot moves, the opposite crutch is going to move for 2-point. I'll do it one going the other way too. So opposite foot, and then opposite crutch for 2-point. Okay, after trialing this a couple times, I normally would always be I'd always be downhill from the patient, just in case there is a loss of balance. I can be there to steady them instead of being above the stairs, but I'm going to stay behind her so that the camera can see what she's doing. Alright, so she's going to do a 2-point gait pattern going down the stairs and then up. Crutch and then foot. Crutch and foot. Good. Okay. And she's going to go back up. Yeah. Okay. Okay. And so for this technique, she's going to do 2-point gait for negotiating a curb, which is going to be crutch and foot together. Yep. Okay, perfect. Okay, so now the patient is going to walk up to the door and push it open with her right hand, and then use the Lofstring crutch to hold the door open because it has a return on it. So we're going to do that. Your 2-point walk. And then use your right hand. Push. Over there. There you go. Okay, and we're doing one additional take for pulling the door open instead of pushing it. We're going to go 2-point gait forwards to the door. Okay. Alright, and then so now we're going to demonstrate safe falling with the crutches. So this patient has already been taught safe falls and safe recovery, but for the purposes of this lab, I'm going to demonstrate how I would advise them for it. And so she has 2 priorities when she's falling. She's going to try to get the crutches away from her, so that way when she's falling, it doesn't poke into her during the fall. And then she's also going to keep her elbows unlocked, so that whenever she lands on her hands, she can kind of absorb the shock a little bit, and so that there's less chance of locking her elbow and then having a fall on an outstretched hand injury from locking the elbow like that during the fall. Okay, good. And so now she's going to recover by trying to reach the crutches and bring them close to her sides, and then try to jackknife up to recover. So go ahead and tilt your torso and see if you can reach these at all. Reach for that one. There you go. And then pull that close. And the other one got lodged kind of behind a trash can, so I'm going to pull it out a little. There you go, and then try to get it. See if you can reach with your foot or your hand. There we go. Okay. And so she's going to bring both crutches in, so that way she can reach it once she does the jackknife maneuver. Go ahead and bring your downward dog up. Yep, there you go. And then grab the crutches. And then put them, grab the hand there. Alright, so I felt obligated to record a alternate stair negotiation sequence, just because stair negotiation is probably going to be, vary from patient to patient. So I feel like with this patient, since she has some issues with her quadriceps, like it's like a fair plus, and then sometimes there's spasms. I wanted to include a segment where we were doing favoring her good leg, kind of, instead of doing like 2-point gait up the stairs. I wanted to do one where we were teaching her to favor her good leg, both going up and down, in case the 2-point gait would result in, I don't know, knee buckling or something like that. Okay. And so for this technique, she's going to lead with her left leg and her crutches, so that way she's using her good foot to slow herself down during descension. Crutches first. Yep. Perfect. There And then when we ascend the stairs, she's going to lead with her good foot and the crutches going up. Well, the reason why it's awkward is because the cups are too tall for you.
Yeah.
Here you go, Paul. You got it. Good. All right, and then so the final thing I want to mention about this case is we also want to be safe if she has to ambulate up or down hills or inclines or anything like that. And so the cue that you would give them just for safety is that when she's going up a hill, she would want to lean forward a little bit as to not lose her balance backwards. If she had the same exact posture going up a hill, she has more of a chance of losing her balance backwards, and vice versa going down the incline. If she's going down the incline, she has to lean backwards a little bit. And that's something probably you would find yourself cueing somebody who has proprioceptive issues in their feet, or maybe vision or something like that, and they aren't aware of their posture already. But it's still a cue worth giving, I think. Thank you.